Welcome and thank you for joining the session Ill Fares the World, Global Health Equity Between Human Rights, National Interests and Weakened Multilateralism. My name is Sven Stockrahm. I'm the head of the science desk at the German website, news website, Zeit Online. And as we speak, the COVID-19 pandemic continues to devastate communities across the world, especially those who still remain cut off by the rollout of vaccines, therapeutics, or basic healthcare in itself. And today we want to discuss what we could have already learned from pandemics in the past. We will talk about the urgency of equal access to healthcare on a global level, if and how the right to health as part of the international human rights law provides a basis for that. And finally, how national interests are weakening international cooperation when it comes to fighting COVID-19. And now I'm very happy to introduce you to our panel of distinguished guests joining us here today. Welcome to Dr. Agnes Binagwaho. She is the Vice Chancellor and co-founder of the University of Global Health Equity in Kigali, Rwanda. She is a renowned pediatrician, a Harvard lecturer, and has spent the last 2 decades transforming the healthcare system of her country into one that has become a model for progress and development. She was the leader of Rwanda's HIV program and served as Minister of Health until 2016. She is currently a senior advisor to the Director General of the World Health Organization. And welcome, Dr. Agnes Binagwaho.
Thank you.
Then I'd like you to introduce you to Armin von Bogdandy. He is the director of the Max Planck Institute for Comparative Public Law and International Law in Heidelberg. He is an internationally renowned professor of public law and has been a member of the German Science Council and of the Scientific Committee of the EU Agency for Fundamental Rights. He was awarded various prizes for his scientific achievements, including the Leibniz Prize, the leading German Research Award. Welcome, Armin von Bogdandy.
Hello, Sven.
And last but certainly not least, Mark Honigsbaum. He is a medical historian, lecturer, and journalist who specializes in the history and science of infectious disease. He's a former chief reporter of The Observer and is a regular contributor to The Lancet and hosts the podcast series Going Viral, the Mother of All Pandemics. Mark Honigsbaum is also the author of 5 books, including the recent Pandemic Century, 100 Years of Panic, Hysteria, and Hubris. Before we start, I want to encourage our audience to submit questions to our panelists throughout the session, and I will try to include some of them at the end of the discussion. So let's start with the topic remembrance and pandemic preparedness. What might we learn from pandemics in the past? Only a couple of days ago, the Independent Panel for Pandemic Preparedness and Response, a panel appointed by the Director General of the World Health Organization to assess the lessons we have learned from the current pandemic, released its report. It concluded that the pandemic could not only have been prevented, but instead the panel finds that the system as it stands now is clearly unfit to prevent another novel and highly infectious pathogen which could emerge at any time from developing into a pandemic. Dr. Binagwaho, I want to start with you. In a recent interview, you said, COVID has brought nothing new. On a global level, it highlighted the inequities that have been there before. Dr. Binagwaho, what went wrong in prevention and preparedness?
Thank you for the question. I have to say that almost everything went wrong. We should, first of all, not forget that a pandemic is an outbreak that is badly managed. And the COVID-19 pandemic has shown that we have not learned from past pandemics. We knew what to do. And we just have to follow science. We didn't follow science. politician has followed politics, and they are the decision makers. The budget, they are the one free the budget needed to react, and they didn't did it on time. Also, there was a lot of mismatch in scientific information. Why we know that, like all coronavirus, it is how it is contagious, how we are contaminating each other. But it was just, we remain blind to follow some politicians just for no reason and because there is no accountability. So we had that experience. We know the evidence-based intervention to apply, washing hands, putting mask. We should have put mask from the beginning. Japanese studies has shown that for the beginning. The decision was to ignore that, and countries and international organizations should have made the genuine effort to keep their memory alive. We had H1N1, and it was stopped because there was the good reaction worldwide. And this is the first time the world faced such a crisis at this scale. And all countries have been affected, but in all countries, the vulnerable have been affected more. And vulnerable is not necessarily the poor. It's people who are more exposed due to their job. And of course, some community group are more exposed because they are more represented in some job and some work. And COVID-19 will be remembered as the pandemic that highlights those inequities. It's not normal that without genetic sensibilities, more Black died. It's not normal because more women are in the front line of health response. They were not protected, more women died. And while the past epidemic have also disproportionately affected the most vulnerable, the fact that COVID-19 impacted all countries and all vulnerable in each countries, we should say never again, but we are sure that it will not be the case because politicians are still not accountable of their mismanagement.
Yes.
And some scientists as well.
Yes, yeah, thank you. So you say COVID-19 is also a crisis in leadership. And now I want to ask Mark Honigsbaum. COVID-19 has impacted billions of people and ourselves, and it has a social, political, economic, probably even cultural consequences. And now it seems inconceivable that future generations will forget about this crisis. But there have been pandemics in the past with millions of people dying that have faded from memory. Not only the Spanish flu of 1918, there have been also others like the HIV pandemic who are barely commemorated. So, Mark Honigsbaum, why is that, and do we need to change that?
Well, yeah, we certainly do need to change it. Answering why this is the case is not straightforward. You know, I've studied the Spanish influenza for many years, as other historians have, and historiographically, it's known as the forgotten pandemic. Why was it forgotten? Well, one reason perhaps was that it coincided with World War I. The height of the pandemic came right at the end of World War I and was rather overshadowed by the closure of that conflict and then the celebrations that followed. But also we have to realize that in 1918, you could easily have lived through that devastating pandemic and not have realized that a pandemic was going on and that people were dying in large numbers. Why? Well, one very obvious difference was that in 1918, we didn't have disease modelers broadcasting every aspect of the spreading infection and sharing, case numbers, infection numbers, hospitalizations and deaths with us, on a regular basis. And when you also remove the fact that there wasn't nearly as active media amplifying and broadcasting those messages because of the need to censor and bolster civilian morale at times of war, then you remove a lot of the factors that make this pandemic memorable. But I think the key difference is that in 1918, there wasn't social distancing on the scale that we've seen it today, okay? Economies were not halted. The needs of war took priority. So whether or not, people register the scale of the deaths, just a very simple statistical fact. I mean, with a case infection fatality rate of around 1%, that means that, 1 in 600 people will have know someone who's died from coronavirus. But unless you have more than a network of like 500 plus friends, you may actually not personally know someone who has died. So what that means is that, you're only going to remember this pandemic because of the impact it's had on your social life, your economic activity. And of course, that has been profound. And we're going to be living with those economic consequences. And also, of course, we're going to be living with the knock-on health consequences, the mental health impacts of the social distancing measures for many years, perhaps decades to come. For those reasons, I do not think this pandemic will be quickly forgotten. But it is striking how people do not seem to blame politicians or governments when, as Agnes says, they fail to follow the science, right? Yes. People think of pandemics as outside of human agency and control, which of course is completely false. Pandemics, epidemics they're not completely preventable, but we can ameliorate them greatly and reduce their impacts. And that depends on politicians following the science, but also making the right decisions at the right time. And until there's some sort of wider public inquiry and reckoning of that, I think there is a danger that people will just want to get back to their lives and park this as like a tragic episode that they want to forget and move on. So that is the danger with this pandemic and all pandemics.
Yes, thank you. Armin von Bogdandy, eradicating infectious diseases has been an international effort at least since the Declaration of Human Rights after the Second World War. In an interview, you said about COVID-19, international law cannot tackle this pandemic, but it won't be solved without international law either. What role has international law played in the COVID-19 pandemic, and what role did it play in past pandemics when it comes to international collaboration?
So in past pandemics, we have to see that the World Health Organization is one of the eldest international organizations in place. And it was set up precisely for the problem of pandemics and infectious diseases. So it was clear that there needs to be a common response to that type of affliction. For that reason, it has always been around. The topic has always been around in the past. I'm not sure that infectious diseases have been treated so far as a human rights issue. There is almost no relationship between the World Health Organization and human rights, and the idea that there is a human right to a life that is as long as possible, that is a very novel situation. Just remember when we had a similar grave disease in Germany in 1969, it was not very different when it comes to the situation in the hospitals. But at that time, the overwhelming idea, and that is in my lifetime, the overwhelming idea, it never made it even to the front pages of the news in the late 60s. And that is because there was the idea that the disease mainly afflicts the old and the sick, and they have to die anyway. So it was seen as a rather natural thing. And we see a very deep change in the last years that type of a disease has become a human rights issue. It's a huge change that we are witnessing.
Yes. Yeah, let's stay at this notion of right to health, or the right to health to support global health equity. Dr. Binagwaho, healthcare for all is a duty of all, you once said. How can we understand health as a human right? What would you say?
The right to health means that all individuals... am I muted? It's okay?
Yes, no, we can hear you.
The concept of right to health means that all individuals, regardless their identity, have the same right. It's universal. It's for everybody. So we have the right to quality care. The idea of global health equity now builds on the concept of human rights with a focus on the most vulnerable, meaning for rich people or people who are educated or know their rights, it's easy to claim it. But for people who doesn't know their right because of the education they had or the lack of education they had, the government are obliged to make them fulfill their rights, even if they don't know that they have their right. And the problem here is that giving them the opportunity to access prevention care and treatment is a right and it's a duty of government. It's not a duty of NGOs. It's not a duty of a citizen vis-a-vis another citizen. It's a duty, right, and signed by the government. And the vulnerability is not necessarily poverty. I told you that. It can be conditions such as a disability or underlying clinical condition, even socioeconomic condition, or bias of societal perception of this group. So global health equity takes the idea of right to health on a global scales, disregard the existence of border. And this is why now the global health community stand up against the scandal of letting people from India dying when they have the skills and the capacity to manufacture vaccine.
Yes. Mr. von Bogdandy, following up on what Mrs. Binagwaho just said, the right to health is not a familiar one on a global scale, not even, or not only in some countries maybe. So maybe from the perspective of international human rights law, what does the concept of the right to health actually mean when it comes to international law?
Well, being a lawyer, I'm always looking at the nitty-gritty, and when it comes to the nitty-gritty, things become more complex. So there is a right to health, and that is in the International Covenant on Social, Economic, and Cultural Rights. But that right to health comes with two main strings. One is that right to health is only with respect to the government of your own country, the country where you are situated. So it is not a cross-border right. So a person from a country in Africa does not have that type of a right against the United States of America or China. That is one element. And the other element is that those rights are subject to the means that a country has. And if there is not sufficient means, there's of course the conflict between the rights of several individuals, and which means that governments have to make very difficult choices of prioritization. That is the one side. At the same time, there is an international duty on states not to hamper the health effort of other countries. So export restrictions, for example, are rather easily to be attacked, particularly in a situation as we have it now in the United States or Canada, which have many more doses of vaccination than what they need to serve their own population. So even though that is not the right of health of a person in Africa against the government of the United States, there is nevertheless a duty of the United States to share, and other countries, to share those vaccines which they don't need for their own populations.
Yes, you already mentioned export restrictions. So this brings us basically to vaccines. And Mark Honigsbaum, you once said pandemics end in two ways: through medicine, and when people stop talking about it, and it's no longer an object of political or social concern. COVID-19 could become the first real pandemic, you said, that we can end with with medical antidotes, and these are vaccines. Maybe you can elaborate on that in introducing the topic of vaccines.
To who is addressed the question, please?
To Mark Honigsbaum, but I'm not sure if you can hear us, or...
I can hear you.
Ah, okay.
Yeah, okay. Yeah, no, there's a lot to unpack there. So just to clarify, of course, not pandemics, but we have ended other infectious disease outbreaks with vaccines, smallpox being the classic example. But to come to COVID-19, I think, vaccines are going to be the primary way in which we stop this pandemic. Of course, there are other measures that will be required, because we can already see that there is a proportion of the population who, for different reasons, will not take a vaccine. And it's going to be very difficult to compel that minority. So we probably are going to be living with COVID in one form or another, with or without vaccines. But certainly in terms of ending the economic and social restrictions and the disruptions to our social life, vaccines are the way out. And we can see that quite clearly with the devastating outbreak that's going on in India, and the way that that outbreak, that variant, is now being imported into the UK, to Bolton, where it's surging primarily among Indian Asian communities, thus posing a risk to other areas of Britain. And that, in microcosm, is the challenge or dilemma that the world as a whole faces, because none of us are isolated from anywhere else in the world. And what happens in one part of the world can potentially impact us in like a high-income country like my own. So we do need to ensure equitable access. But the real question in terms of ending this pandemic is, well, there's two issues. One, there's a moral issue. And we've seen this play out in the debates between lockdown skeptics and those who think that the priority is to protect the elderly, most vulnerable members of the population. So there's a moral imperative. And for me, the highest law, as they put in the Roman Republic, is the preservation of health or life. And so that moral principle should take precedence. The problem, of course, becomes, how do you preserve and protect everyone's life when you have a limited supply of vaccines, or you can't get vaccines everywhere in the world at the same time? And that is not a straightforward, it's not straightforward answering that. Obviously, I think that, high-income countries have a duty to share as many of their vaccines as possible with India and other parts of the world who don't have as good access. But you will see these pinch points where suddenly infections are surging, as they are in Bolton now. And, the priority then becomes domestically to start to vaccinate down the age ranges before, for instance, exporting your vaccines so that elderly people and the elder age ranges in India and other parts of the world can be vaccinated. But we need to try and to do both things at once as much as possible. And I think that, it's impossible to predict, but there will eventually be some sort of medical end to this pandemic. But I think we're going to be living with the psychological and social repercussions for many, many years to come. And seeing an end to that is not clear. I don't think we can really envisage how and when the pandemic will end in a social sense.
Yes. Only recently, the New York Times pointed out that the pandemic has split in two. We see almost 0 deaths in some cities across the world and thousands in others. We already brought up, or Dr. Binagwaho already brought up India and the situation there at the moment. You as well, Mr. Honigsbaum. The fault lines continue to widen as vaccines flow toward rich countries. We already said that. So the Director General of the World Health Organization tweeted that some countries with high vaccination rates appear to be in the mindset that the pandemic is over, while others are experiencing huge waves of infection. The pandemic is a long way from over, he says, and it won't be over anywhere until it's over everywhere. So, Dr. Binagwaho, maybe you can elaborate on the topic that pandemics demand global solutions. Are we failing to distribute vaccines equitably across the world?
Please?
Ah.
Yes.
Yes, now we can hear.
Yes. So I just say that this should not be a question because the answer is immediate and a dramatic yes. We are failing the distribution of COVID-19 vaccine equitably across the globe. For instance, only 1% of African population has received at least a first dose, while high-income countries are starting to vaccinate 12 years old, when we know that this category is not at risk. But it's a bad calculation, as it was just told by Mark, because we all know also as scientists that viruses are mutating permanently. That's the issue of finding a vaccine for HIV. So we all know that COVID-19 will produce a COVID 21, 22, or 23. We don't know, but it will. And at that time, the vaccine for COVID-19 may not respond. So it's also a scientific imperative to stop the pandemic using vaccine wisely. And it's not complicated to stop the spread using it wisely. By vaccinated first, the most at risk, the people who are living in a crowded situation, the people who are interacting a lot with other communities, etc. So ethical, economic, and scientific argument are there. And also the global health security argument is there also. We are failing it and we are going to cry about it because I don't know where the variant will no longer respond to the vaccine, but there is no scientific on Earth who doesn't have that in mind, and we don't say it enough. We are failing the world. We are failing the high-income countries because they are failing the low-income countries. And when you see a country like Canada, who have 600 times order the vaccine needed for the entire population, but when they will have a problem, there will no longer be solidarity as well, because they show the way.
Yes, we are coming to the topic of vaccine nationalism then, because despite promises of billions of dollars in funding from high-income countries, COVAX, the vaccine pillar of the international collaboration to accelerate the development, production, and equitable access to COVID-19 diagnostics, treatments, and vaccines, is struggling, and by trying to secure more vaccines for themselves, rich countries are undermining COVAX and prolonging the pandemic. This is also what the Director General of the World Health Organization said. So maybe Mr. von Bogdandy, talking about vaccine nationalism, it is probably legitimate for countries to care for their own population, but they also have a responsibility for the population of other countries. You said that already. So how can international legal standards and law be part of the solution here?
Well, it can be part of the solution by supporting and using COVAX. I think COVAX is a very important initiative. In my understanding, it has been the first time that there has been from the outset a coordinated international effort to stem such a disease. So I think that is something to celebrate. And I'm sure that we would be in a much better situation if that initiative would have been the general one. That's to say that also the developed countries, such as Germany or the United States or the United Kingdom, would have used that mechanism for its own needs. So that has not happened, unfortunately, and I think much of the hiccup that has happened between the European Union and the United Kingdom would have been avoided if that mechanism would have been used. But I fully share the idea that COVAX should be supported, and we can only tell the politicians and also the public at large. I think the politicians are hesitant because they see that many people prefer to have their close environment vaccinated first. It's not that the politicians are bad people, but they are responding to the overwhelming expectations in their population. So we don't have just to convince politicians, but people all around. So I hope many people are listening here to the Körber Foundation, that it's in the best interest of all to spread the vaccine via COVAX.
Yes. Thinking about the reasons behind the imbalance in global distribution of vaccines, do you think, Mr. von Bogdandy, that licensing or even a waiver of intellectual property rights, as has already been discussed, could that help? Is that a way to strengthen COVAX in the end?
So I'm a lawyer and not a technical expert on the production of vaccines. So what I see is that many people and people that I see as reasonable people say that even if there is the waiver and if it is not protected anymore, it will be very difficult for other companies to produce the high-end vaccines. So in that light, it would not help very much. But at the same time, the very discussion might put pressure on those who are producing the vaccines and who are hoarding the vaccines to come up with more equitable arrangements so that even people in lower income countries might be served. So my answer is, I think the waiver in itself will not be greatly helpful, but I think the discussion might help to improve the situation.
Yes. Mark Honigsbaum, maybe to have a more like a historic perspective on that too. This attitude of my country first, is this something we have seen in past pandemics as well? Maybe not to that extent, but is vaccine nationalism, would you say, a crisis in itself?
Is vaccine nationalism a crisis in itself? I think certainly the spread of populism and nationalist sentiments do very much present a threat to the global liberal order. And, really the whole post-World War II effort to ensure a more equitable distribution of global health goods and other goods. The point is that, and it goes really back to the initial question, did the world fail in its response to, did we fail to really imagine and prepare and prevent this pandemic? And the answer is that although advanced countries invested a lot in global health security systems so that we were much better able to detect an early outbreak. One of the big lessons for high-income countries is we didn't invest nearly enough in public health systems and all the infrastructure we need to actually combat an epidemic if it got out of control. So there was a huge element of complacency. And a lot of this goes back to the third word in the subtitle of my book, hubris, right? The lesson of the sort of last 100 years of pandemics and epidemics is that we're always preparing for the last epidemic and failing to be flexible enough in our thoughts and in the way we prepare for the unknown outbreak coming down the tracks, whatever it might be. So we spent an awful long time in the early noughties preparing for an influenza outbreak. And that is the mindset that we brought to the coronavirus. When we should have actually been thinking, no, this is a completely different virus. And because of that, there are things we can do. The problem is that, we now know that one of the most effective ways of stopping and containing that outbreak would have been to close borders, right? To put up borders. But of course, the advice from the World Health Organization prior to that is that it's very risky to close borders and have travel bans because that limits your ability, for instance, to distribute medical resources, therapeutic drugs and vaccines in the way that you need to, so that everybody in the world has access to those resources. So there is a very difficult balancing act to strike between these nationalist sentiments, these desire to protect and safeguard your own citizens and also your own economies, against the fact that we live in a global economy, but we're also one world from an epidemiological sense. It's not like in the 19th century where you could potentially, halt cholera at the border by imposing strict maritime quarantines, or indeed the situation we had in the 14th century, where you could have lazarettos and sort of quarantine regulations just try and stop plague spreading. We don't have that option today. Because as we've seen, it's impossible to stop a pathogen pouring across porous borders when we're also connected in terms of travel and trade. So that really isn't an option now, but there is a balance to be struck between rational short-term nationalist measures and our sort of long-term objective, which is that nowhere in the world essentially is safe until everywhere in the world is safe.
Yes. At the center of all efforts to fight the pandemic on a global level sits the World Health Organization. Dr. Binagwaho, I introduced you being a senior advisor to the Director General, and my question would be: can the World Health Organization be an essential part of the multilateral world order, and how can it contribute to global health equity? And because we see we're getting a lot of advice from the World Health Organization, it seems rather weak in its efforts if I might say so. So how can this organization be strengthened, and how can it contribute to global health equity? What do you think?
First of all, I want to rectify something. Since the time I accept to be part of this great discussion, I have resigned because I'm against what they did. So I'm no longer an advisor because our advice are not followed. WHO follow the science where it suits WHO, not when the people need to follow science. Now, should we need an organization that help the world to find their way in a guidance and protocols and understanding? Yes. But how it is? No. Need strong restructurations. But I also want to come back to two things Mark has said. First of all, after the Second World War, the world was not so humanitarian, All Africa was colonized and mistreated, and we were out of those benefits, same as Asian country, etc. And also, when we say scientists should be more courageous and politicians should be more courageous, because when we say vaccine nationalism, our people first, if you do things that put your people in danger just because of populism, this is wrong, and we should all stand up and say it. Because of the risk of variant, etc., we have talked about. So, WHO reformed, yes. It is needed, yes, but should totally be changed and far more scientific, not bureaucrats that are highly paid in Geneva and not knowing what happened in the world.
Yes, maybe following up on that, you have a lot of experiences in promoting and actually carrying out vaccine campaigns, and all across the world there have been, mostly across the African continent, there have been state actors and NGOs joining forces to eradicate malaria or the yellow fever, for example. So what can we learn from those endeavors? And maybe you can speak from your own experience here too.
So this is a research, and we can ask ourselves, all the world went deeply in searching solution for COVID-19, and they made it. The effort, the money, the attention was there. For other disease, it's lacking. That's why it's lagged behind. But when you have the vaccine, I want also to say that one of the problem we had with COVAX and with WHO is that they say, we are in charge, we will help you. So country didn't prepare. And this is wrong. You need to push country to be logistically prepared to bring the doses to the last elderly, to the last health workers inside the country. And it's a simple logistics. And country who can move plane around the sky and bring them at the right place, at the right time, at the right minute, to not crash with another plane that is taking off. It's far more complicated to bring the vaccine to the right body at the right time, in the right condition. So it is careless. You need to be prepared before getting the vaccine. It's like when you travel, you need a visa in your passport before traveling, not at the airport. So logistics is important. Failing logistics has no excuse for any country. And many countries have failed it. In New York and in Africa, we have some issues as well. And being prepared is a duty of the leadership. And the leadership has failed this pandemic and their people. I don't know if I answer your question.
Thank you. I think before we have some time for questions from the audience as well. But before that, I wanted to ask a question to all three of you, and maybe Mark Honigsbaum can start. And the question is thinking about, let's say, a world after COVID-19, or let's say a world after a pandemic with COVID-19, maybe not without the coronavirus. But do you think that a shared crisis like COVID-19, with all its shortcomings in international collaboration, can it create openings for new global collaborations across dividing lines? What do you think?
Well, I certainly hope it can. Of course, you know, the great fear is that we've seen that the pandemic sows as many divisions as it brings people together. And then that goes right back to the beginning of the outbreak. You know, so what did we see at the beginning? We saw certain politicians blaming China and essentially accusing China of maybe an accidental biological release rather than this being a natural event due to, you know, ecological conditions. So I think there are two sort of possible roads we could go down. I certainly hope we go down the road of greater cooperation, and that crucially depends on you know, certain countries showing that sort of moral leadership. So I was greatly relieved, of course, that Joe Biden won the presidential election in the United States. And, you know, just yesterday, he pledged to send 80 million doses of America's vaccine stockpile to other countries. That is the sort of moral leadership that we need, and I think we need more of. Why? Well, for one thing, you know, it's very important for democratic countries to step up here, because Agnes was saying this actually in the pre-discussion. The big danger is that if the European Union, United States, Western leaders do not do that, then China may step in to the breach and exploit it. And that's very, very dangerous, because although there are lots of things China does well, I think we'd all agree that human rights and transparency is not one of them. But we do need to work together, because, you know, it's highly likely, you know, based on history, the majority of epidemics and pandemics do start in Southeast Asia. That's not because those countries are somehow at fault. We know it's got to do with the particular ecological conditions that pertain in those countries, and the greater number of the greater density of animal populations and human populations, essentially. And these are the fundamental challenge, because whatever happens with COVID, there will be new epidemics. There will be another pandemic. And, based on the recent run of epidemics and pandemics, they are becoming more frequent, okay? And it's really only luck and good fortune, for instance, that the swine flu outbreak in 2009 didn't turn out to be a very, very severe, it was a pandemic. Luckily, it wasn't severe in the way that COVID has been. But we are facing a variety of threats, some of which we know about, many which we can't know about yet because they haven't happened. So we need systems in place. And that requires sharing information quickly and early. And also being transparent, because one of the things that made it so difficult for the world to respond appropriately to this outbreak was the confusion over what was happening in China, because the Chinese, unfortunately, were not transparent, at least in those initial weeks and months, about the true extent of the outbreak, and they didn't share data in a timely fashion. They shared the genetic code of the virus, which was very, very important. That's why we have vaccines now in record time. We've never had vaccines within a year of an outbreak like this. But of course, we were greatly hampered because we really didn't know how big a threat it was. And people were very reluctant to believe that something they saw happening before their eyes on television, with hospitals being built overnight and these massive waiting rooms, could actually happen in developed Western countries until it did.
Yeah, maybe Armin von Bogdandy, would you like to follow up on that? Do you think there are new opportunities for global or international collaboration coming from these crises?
So as with every crisis, there are many possibilities. So it can go, it might become better and it might become worse. The only thing that we know is that it won't stay as it is today. That's the only certainty that we do have. And so at that point, what I can say is that COVAX is truly a new initiative. It is a new beginning in international law when we think of other situations such as the AIDS epidemic or the other pandemics that we have experienced. Nothing similar has happened in such a short time frame. So I think if we want to have a positive outcome, there's a great interest to make the COVAX initiative work. Then we can build up the experience also on the ground, how such things happen. Otherwise, if it does not, to those who are nationalists, they will see that is another proof that such type of international cooperation does not work, that the vaccines that are distributed, they disappear in strange channels or are sold at a very high price on a black market. So a lot of things can go wrong there. And I think we should really try to make a COVAX a success. If it fails, it will hamper future cooperation on such issues for many years to come.
Yeah, and finally, Dr. Binagwaho, what are your thoughts on that? Do you have hope for international collaboration?
Yes, because first of all, scientists are beyond politicians. They are bad scientists. Huh? I don't say that because you are a scientist, you are a good person. And people have collaborated. And people, I remember us taking the phone because we talk about China, but talk about Singapore, talk about Vietnam, talk about those countries who made it, even at the border of China. How come that Italy didn't make it? Far away. So, yes, I believe because I know that the people here in Rwanda talk and ask them how they did it because they were in advance in the epidemic where we are. They were attacked by the virus before. So I believe that there is an opportunity. I believe that in each crisis, there is an opportunity to improve. Each country should have a strategic plan to tackle outbreaks and pandemic. Outbreaks is a national, a pandemic is in your country is an outbreak. So, and stuck to it, because explaining that it's due to the lack of transparency of China as an excuse is false. I was in March in Europe. I was on my way to the US when I saw that friends of some kids, little kids of my friends, were sent still in Italia for school tour, when Italy was at the peak of the epidemic, and the Ministry of Health allowed that. So I don't get that excuse. And also, how come that we, before March, stop the plane we had to China and start contact tracing for countries at risk before having a first case in Rwanda, just because we read what China put on their website and not believing what your eyes are seeing because you are in Europe and in China? I'm sorry, this is called arrogance of rich countries, not failure of China. So there is a moral failure in leadership. It fell short. Africa don't care about who gave you the vaccine. We care about the quality of vaccine we receive. And I don't want to say that it's bad that Europeans are making case of when they help us. Why China will not make case when they are helping us? They do exactly what you do, and you blame them for that. So we should stop the high-income countries' arrogance and look at the world as it is now. It's better for all of us.
Yes, thank you, Dr. Binagwaho. I think we should try to put in some questions from the audience that have been in the chat, and I'm trying to see if there's something that can add up to what you just said. Yes, there's a question. We talked about the US sharing some of their vaccine doses as I think Mark Honigsbaum, you said it as it's a part of like a moral leadership in a sense. But the person who posed the question says that 60% of the American population is already vaccinated, so they just probably don't need all the doses anymore. So is it just moral, like a moral gesture, or is it because the country or a lot of Americans have already been vaccinated? What is your stance on that, Mark Honigsbaum?
Well, I mean, look, it's certainly true that America is in a better position than most countries, perhaps with the exception of England, where we're very close to similar levels of vaccination. But I mean, it's not just the United States who've over-ordered vaccines.
Exactly.
I think the Wellcome Trust did a survey and it shows that I think that 13 countries have ordered more vaccine than is required to vaccinate their whole populations. So, I mean, the fact is that America is in a good position. They can afford to do this. But, you know, just ask yourself, do you think that the previous president, Donald Trump, would have done this? I don't know. I have a big question mark about that. So I do think that we should give Joe Biden the benefit of the doubt. Of course, there's an element of self-interest, but I think he is trying to show leadership, and I think 80 million is not inconsiderable. Presumably, they could give even more, but it's also the point of moral leadership is it shows the way for other countries. So if other countries, and there are 13 who have more vaccines than they could possibly need, also do the same thing, then we begin to change that dynamic and we're moving in the right direction. And that is surely the most important thing we can do now, and perhaps the best we can hope for at this moment in time.
Yes, Dr. Binagwaho, do you want to comment on that as well? Because we have two questions left, and these are more about topics that we had earlier in the discussion.
I can just say that what Mark is saying is true. However, it still fell short in leadership. They should fight for any possibility to manufacture a vaccine in any place in the world with quality to be used, and they don't do that. What should be the true leadership? So it's a gesture to look good and to pretend sleeping well at night when they should die with nightmare. And we can make keeping intellectual property and ownership. Those vaccine manufacture elsewhere and save really life, because those 80% will vaccinate maybe 1, 2, 3% of the population on Earth. So it's just pretending.
Yes, thank you, Dr. Binagwaho. Wow. There's another question. I think it's directed to Armin von Bogdandy, and it's again about the role of international law and what role it played in past pandemics. We have talked now a lot about COVAX and collaboration, but international law, has it been part of past pandemics, and did it change something in the past?
I think, yes, it did. For example, when it comes to AIDS and helping, in particular, the African continent with respect to AIDS, I think there has been a UN agency that has been quite important in helping many people in that terrible situation. So I think, yes, it does. It has been playing a role. As always, it is playing only a small role, but even a small role might be an important one if things are really terrible.
Yes, thank you. And there's another question, maybe a brief answer from you, Mark Honigsbaum. It's again about the historical impacts of pandemics. And the question is, given the wide-ranging social, economic, and political impacts of COVID-19, it seems natural to assume that the same must have been true of past pandemics or epidemics and pandemics. Is this the case? You said something in the beginning about that, like about fading memory. But what historical impacts did past pandemics really have, if any?
That's a very good question. So, yeah, I mean, there's a widespread assumption that pandemics, because they cause such widespread disruption and death, must have these profound political and social impacts. Actually, if you look at this closely in history, you'll find that except where pandemics have major demographic impacts, which have produce long-lasting economic and structural changes, in actual fact, most pandemics and epidemics do not have these profound influences on society. That is not to say that they cannot have subtle cultural and social influences. So, for instance, if we think of the way that today identity politics is so important, and the whole rights discourse around the rights of minority groups, a lot of that goes back to the HIV/AIDS, experience of HIV/AIDS, first of all in America, where there was discrimination against gay men, homosexual men. But also, you know, the concern that we were doing a lot for the West, but the real impact would be felt in Africa. So I do think that epidemics and pandemics can have these more subtle and perhaps, you know, long-lasting cultural impacts. They can change the way that we experience time, for instance. I know that might not sound very profound, but we've all been living with a very different sense of time during these lockdowns.
Yes.
And that's caused a lot of people to reevaluate not only their own priorities and the priorities of their families, but the sort of community and world that they wish their children to inherit. And we don't know how that will play out, but that could have very, very, very dramatic effects.
Yes, thank you, Mr. Honigsbaum. We are running out of time already, and I want to conclude this session with a quote from you, Dr. Binagwaho. You said, "The right to health is not a joke. It is part of the rights you have the day you are born." And this concludes our session today. Thank you very much to our panelists, Mark Honigsbaum, Armin von Bogdandy, and Dr. Binagwaho. And after a short break, you can join Dr. Agnes Binagwaho in a deep dive conversation with Dr. Charlie Weller from the Wellcome Trust about health as a human right and its implications for African countries and the world. Thank you very much.
Thank you.
Thank you. It was a pleasure to be with all of you. Bye, Mark. Bye, Armin.
Bye, Agnes. Nice to meet you.
Bye-bye. Thank you.
Virtually.